what happens when someone who understands the medical system from the inside suddenly finds themselves navigating it as a patient. Today, we are joined by Dr. Zeest Khan. Her story offers a rare and powerful perspective. Zeest is a physician, a business owner, and a mother who once managed cardiac surgery and led her own medical practice until long COVID changed the course of her life. Her journey took her from being fully independent and leading others to relying on support just to get through daily life. Through that experience, she gained not only insight into chronic illness, but also a deep understanding of what patients truly face and what needs to change within modern healthcare. She now dedicates her work to helping patients better understand the medical system, make informed decisions, and rebuild trust between doctors and patients. Welcome back to Autoimmune Adventures, where we explore real-life experiences, challenges, and victories of living with chronic illness, and the powerful lessons that help us live boldly along the way. Today's episode is one that we believe will speak deeply to many of us that are listening today. We are honored to have you and welcome you, Dr. Zeest Khan, to the show today.
I am so pleased to be here. Thank you for having me.
We'd really love to start with your story. We always love to hear other people's stories. So before long COVID, you were managing cardiac surgery, running your own medical practice, from my understanding, and of course, caring for your family, living a very full and demanding life, from what I can tell. So can you share with us what life looked like before long COVID and how everything changed when your symptoms began?
Sure. So before 2019, I finally felt like I was hitting my groove in life. It only took me 40 years. Our training is so long that, I was really feeling settled. And you guys know how at that phase of life in your 20s and 30s, you're doing so many different big things. And I finally felt like I was catching my breath. I am a cardiothoracic anesthesiologist, which means I specialize in anesthesia for open heart and lung surgery. I was in my groove for my career. I moved from the Silicon Valley to the Central California Valley, my hometown, and was able to establish my own independent practice, which isn't very common for anesthesiologists. But that way, I was able to work with multiple community hospitals and really fill a need for, physicians in this area. And I was able to practice my subspecialty and, lighter weight cases. And my kids were healthy and growing. We bought a house. My husband was doing well. And I celebrated my 40th birthday. And then COVID hit. Our hospitals were hit very hard in this area of Northern California. I don't know if you remember those maps that were made for COVID that were color-coded. We were red from the moment those started being produced to the time they stopped. And we had outbreaks of COVID among hospital staff. I have a history of allergies and I get sinus infections from time to time. So I thought I was just having another bout of allergies, a cold or a sinus infection in the spring of 2020. But by the summer, I knew something was wrong. I was very fatigued and I was having a hard time walking or doing anything as active as I used to do. I was completely drained by the end of my shifts. I was drained at the beginning of my shifts. I remember sitting in my car in the parking lot, willing myself to get out of the car and make it to the hospital entrance. It has got that bad. So I started thinking, I wonder if this was a COVID infection. Now, remember at that time when I got sick, there were no tests readily available. They were just being developed. And those that, the ones we had were used for the most critically ill and for research, presumably. So I had no way of knowing. So I'm one of the millions of people who have a presumed infection. And by the end of 2020, was not only having difficulty walking from my car to the hospital door, I was having a hard time walking down the hall. I found myself sitting. I found myself taking the elevator, a flight of stairs, when I used to run up several flights. I started asking for help. Anesthesia is a really physical job. And I started asking for help with physical tasks. By December, when the vaccines first were introduced, I knew something was really wrong, but I was willing myself to get through because I had committed to my community hospitals. I had committed to my colleagues, and I didn't want to let them down, and I didn't want to let my community down. I probably should have stopped earlier, but I was having, that guilt and that desire to go and help. I had progressive shortness of breath. And finally, I decided, hey, I'm going to stop. In April, I'm not going to take any more work, and I'm just going to take a little time off. I thought maybe I was burnt out. I was tired from all of the heavy load that we were all carrying. And before I could do it on my own, my body said, oh, you're stopping now. And at the end of a hospital shift in early March 2021, I collapsed outside the hospital doors and I couldn't make it to my car. I just had no energy to make it to my car. I sat by a sweet little tree. I leaned up against it, and I found someone who was wheelchairing a patient into their car to help me get to mine. And I finally made it home. And that was the last time I practiced anesthesia. I realized I had a lot more serious symptoms than I realized even over that year. I learned about long COVID, which we can talk about, the name was coined by patients. The first time any of this made sense was by talking to other patients. And my full-time job has been recovery.
That is heartbreaking. And that is heartbreaking to have something that you put so much of your life into and to have to give it up. But we know that will resonate with a lot of people, because a lot of people that are experiencing chronic illness or long COVID and that have had a similar experience where they have to give up their life's work basically because they physically aren't able to do it anymore. You mentioned talking to patients, and that was where you got a lot of your information. It's a very unique perspective you have to have been on both sides, like to be a healthcare provider and a patient. When you became a patient, what was maybe one of the things that was a surprise to you, or something that you had not expected or didn't fully understand maybe when you were on the other side as a physician?
So yeah, I was surprised becoming a patient. It wasn't an identity I ever wanted to take on, but illness isn't new to me, if not personally, then in my family. Not only am I, someone whose specialty is the most critically ill people and arguably the entire hospital. But I've had family members who've been ill, who've had medical needs, who've had medical crises. And I've played that role of being the mediator and the bridge between the healthcare system and the, people who utilize the healthcare system. So what surprised me when I started asking for help is, you guys probably know this too, there wasn't a lot of help. And that was something that I had to really come to terms with, that this field that I had dedicated my life to couldn't show up for me and serve me in my time of need. I also was really surprised by what I saw physicians doing, which was when I told them my story, even the ones, who were really sincerely wanted to help, they'd kind of at the end of the appointment shrug their shoulders and be like, I don't know. And then it would just end there. And I would have to be the one who like, okay, like what other ideas do you have? Like who else should I talk to? And I think I've learned a lot about the psyche of healthcare professionals, especially doctors, where we have a really hard time admitting we don't know something. We try to deny it so much that we are not accustomed to navigating uncertainty and knowing what to do when we admit, I don't have all the answers. So I think that's what's really surprised me the most, maybe because my field has always been like, what do we do next? What do we do next? This is unexpected. An anesthesia, heart surgery, trauma surgery, even like a typical, outpatient procedure that sometimes has surprises. It's dynamic. You're always vigilant and you're always asking like, what do I do next if my plan doesn't go the way I expected? And I just didn't see that enough in my own care.
Some of the doctors that I have had that I respect the most, because like you said, that is a problem, but I have had some doctors that will honestly admit, I don't know what to do with this. But then they come back and say, but we're going to figure it out together.
Yeah.
Or I know somebody who knows about this and I can refer you to them, or I'm going to consult with them. And so it is, like you said, I think it's something that happens. And let's admit, I mean, nobody here likes to be wrong, or nobody likes to admit that they don't know something. I don't know anybody that would be like, yeah, I'm all about that, but especially in a profession where people kind of expect you to have the answers in some ways, that would be a really challenging thing. So yeah, I bet that was interesting to see from the other side of the coin on that one.
And that kind of leads me to the next question, which is, I mean, you got to experience this, unfortunately, but you probably felt a little bit dismissed and unheard, maybe misunderstood. But I think a lot of people in the chronic illness community, the three of us included, we have all experienced medical gaslighting. And when it comes to managing chronic illness and long COVID, autoimmune, whatever it might be, that's almost, you can almost expect it to happen at some point, right? But it's always interesting hearing kind of from the other side. So do you think that, maybe it's pride that they don't want to say that they don't know? Or, I mean, why do you think that happens?
Yeah. I mean, I saw your like hesitance to say it's almost a given. I think it is a given, unfortunately, that patients with chronic illness are going to be dismissed and gaslit by a medical professional, at least one along the way. And I think the reasons for this are multifactorial. And only one is that in our medical training, we are not accustomed to admitting that we're wrong. We're actually punished pretty publicly when we don't have the answer. If you've ever watched a medical program where a senior physician asks a resident physician or a medical student an answer and they start stammering, they get made fun of. It's humiliating. And we don't see enough models of teachers who help us understand you are not going to know the answer at some point, at probably many points, and this is how you can proceed. So I think there's a sort of trauma response that doctors have where they may not even understand that they were trained this way, that they have this trigger. They just respond viscerally. And so that's one part of it. It's easier to dismiss it as something that doesn't exist versus something that I don't know. That's one part of it. But the other part of it, quite frankly, is rooted in these other systemic barriers to healthcare. A big one is misogyny. Chronic conditions, autoimmune conditions, even menopause happens to women of a certain age, and we become systematically dismissed and denied, and our problems get swept under the rug as something that is caused by anxiety, which is then equated with made up imaginary and a personal flaw, a proof that like women are weak. I'll just be on my soapbox here for a few minutes.
Love it.
But this is a big reason. The fact that myalgic encephalomyelitis and chronic fatigue syndrome and rheumatoid arthritis and multiple sclerosis are all heavily felt by women, disproportionately affect women, is one of the reasons we don't have treatments right now for a post-viral condition that is presenting like so many other post-viral conditions over the past 50 years. This harms not only women, but the men who present with it. If you start moralizing fatigue as a personal weakness, you're gonna discourage people who need help from admitting they have a problem. So that's one. And you're also going to reduce the funding that you give for the research. You're going to stop asking questions. It's like that shoulder shrug, like this is, a crazy lady problem.
Yeah.
So that's a big part of it. And there's other, barriers. I think long COVID is vastly underreported. And right now it is being diagnosed in populations who have affluence and access to healthcare. And it is not being diagnosed or treated among minority groups or the rest of the population at large. So, that's what I think the systemic issues are. Of course, there's also the inherent complexity of a post-viral illness. Like, we still don't have a medical field that post-viral illness falls into. Nobody really owns it in medicine. And when you have such a fragmented healthcare system, that becomes a problem because your doctors are trying to send you to an expert. And like, where do the experts live? We don't have a home for it yet. So the complexity and like the inherent scientific biological complexity of a post-viral illness, it's really hard to recognize or diagnose these conditions based on blood work, based on, some parameters that are repeatable. It presents in, so many different ways that it takes some nuance and some, looking a little harder to diagnose and treat something like this. And when you have a really, really busy, overwhelmed, overworked healthcare system, the last thing you have is extra time.
Yep, that's what I was going to say. It definitely comes into play. I think that the doctors are on a clock and most have quotas they have to fill and they have to get stuff done and they have to move and you only get this little chunk of time with them. And if you can't present what's going on in a really quick and concise way, it's understandable that they're not going to be able to see the whole picture. So I really appreciate hearing it from the point of view of a doctor, because I have been on the medical gaslit side so often that you get a little bit of a chip on your shoulder, and I love when we have doctors on because I go, okay, oh yes, they are still people. They are people. They are doing their best. They are really trying, but I've also definitely been a victim of misogyny in the doctor's office. Not that long ago, I had to walk out of an appointment, fired a guy on the spot. And it was embarrassing for me. I sat there before I spoke up for myself. And I was like, am I really what if I'm crazy? What if I'm just showing up here for no reason? And then I was like, what? I'm not. Nobody goes to a cardiologist for fun. That is not something we do for fun, So after I composed myself, then I was like, you know what, this isn't going to work for me. And I just walked out. But it took me a lot of years and a lot of experiences to get that. But in hindsight, I look back and I go, okay, he can't help the way he was trained. He came in and just saw me and assumed I was fine. I don't know what the deal was, but I was really angry. You can ask my sisters. I called them and I ranted and I was like, you would not believe what just happened to me. And I went off and I wrote a nasty review and all of these things. I was so upset. And then I talked to the lady that was over him in HR and she was like, he actually felt terrible about that. He knows that he screwed up and he felt terrible about it. I promise you he's a good doctor. And I was like, okay, all right. I'm glad he felt terrible. But I started having a softer lens on the situation and saying, okay, I don't know his reasons, but he's human too. So thank you for providing both sides of that. I think that's helpful.
Well, Alysia, I want to acknowledge how hard and hurtful that kind of experience is, and also the underlying reality that you probably were able to say something and walk out because you had been there before, and that wasn't the first time. And that is a reality that patients face right now. It's a real problem in our medical culture. And yet it's so prevalent. I'm sorry.
I'm just glad that it happened to me. And I have the balls, quote unquote, to say, no, thank you. I don't need to work with somebody who's not listening to me, and walk out, because I know a lot of other people who wouldn't have had the balls to do that,
Because there's a power dynamic
Absolutely.
in the clinic office, in the hospital.
Absolutely.
Even if you just think of it as like you're lying down on a bed in the ER and everybody else is standing over you. And there's that psychological power dynamic that really is anachronistic at that time. It's time for that to change.
Yeah. Absolutely.
I've learned one simple line that almost always serves me when I find myself in a situation like that. I very calmly look at the person who's talking to me that way, whether it's a doctor or even someone higher up on the food chain, so to speak. And I say, I am addressing you with respect, and I expect to have the favor returned. And it is amazing how quickly that will bring someone into a state of, oh, well, I wasn't intending to be offensive, or no, I really am the jerk you think I am. And then at that point, it becomes a lot easier to know, how do I move forward? Because I think that so often in life, it's really easy to be offended. It's really easy to be offended because we're there and we're hurting and we want help. But if the person in front of us is just as confused by what is going on than we are, it would be nice if they admitted that they didn't know. But I also understand, like we've discussed, that that may not be an option. So here we are dealing with long COVID, and it's new. This isn't something that anyone's going to know about. So my question to you is, when someone finds out that they have long COVID or another post-viral or chronic illness, those early days are really hard, as I know you can attest to. What are some of the very first steps that someone can take when they begin experiencing symptoms that don't seem like they're going to be going away?
It's a great question, Stacy. I would love if you will allow me to comment on what you said too about
Please.
your script that you have had to create for the inevitable eventuality of the scenario where you're not treated well by someone in healthcare. And this is something that your listeners might have in their back pockets too. It feels so hurtful and really deteriorates the trust between, we'll say, doctor and patient. I say in my writing, in my podcast, about how the clinic office is so small and there's typically 2 people in there, and they might as well sometimes be living on different planets. We're sitting across from each other in our little bubbles, and we've brought with us all of the baggage from our previous experiences with healthcare. Patients are bringing their fears, very reasonable fears and previous experiences of being dismissed, of being gaslit, of saying, someone saying, I can't help you, or like, this is all in your head. And so they're not going to offer trust as the default. And, doctors and other healthcare professionals are being wrung out by our healthcare system in the US right now. We had a once in a century pandemic. People in the hospitals, like I said, I take care of patients who are sicker than anyone else. I use really advanced technology, and I'm doing things that do not look normal, like Frankenstein. And when I entered the COVID wards, I felt like I was in a parallel universe. And so if it was shocking to me, imagine how it looks to an X-ray tech, to a radiologist, to anybody working in the ERs. And we have not had time to process any of that, or have been allowed to be like, hey, maybe we should take care of you guys too. And this is not to diminish blame, but to acknowledge that people are burned out, people have moral injury, and people have been harmed by this healthcare system. And then they go face to face in the hospital setting sometimes, and it can be an adversarial relationship when it really should be collaborative. So that's what I wanted to say about that.
It's why I chose to ask the question instead of just leaving or pitching a fit or bursting into tears or doing any of the other things that might be an immediate reaction for someone. If I've learned that you can very kindly and lovingly look at another person and say, I want to meet you in respect. I came in here with respect for your qualifications. Could you please return the favor? And it's just, I have found it to be the kindest way to say, can we please collaborate? That's ultimately what we want to do, is collaborate, because I know that my doctor, when I walk in, does care about me. I know they care about me, or they wouldn't do what they do. I know they want to help, or they wouldn't be there. And so I like to assume the best possible scenario.
You're offering.
I offer that because I understand. And also I've been not a doctor, but I've been a teacher, and I understand like what it was like to be in a classroom with people who could make me sick and still care about them and still want to do everything I could to help them. And so I try to meet people with respect, but so thank you for speaking to that. I appreciate it. So really quickly, just getting back to the concept of long COVID and post-viral and chronic illness, when someone is first diagnosed, that's really kind of unnerving and scary for them. What are some first steps that someone can take when they begin to receive a diagnosis or they're in a state of not knowing what's going on?
Sure. I think diagnosis is a big part of the battle. When I developed long COVID symptoms, they did not make sense to me. And I was already, 10 years into my own practice. I didn't know what connected these symptoms. We talk in medicine about constellations of symptoms because they might be separate, but they tell a story. And I couldn't come up with a story for my symptoms. So what I would remind people is that long COVID is the sort of colloquial term for this condition that is called medically post-acute sequelae of COVID-19, or really confusingly similar acronym, post-COVID-19 syndrome. PCS are in both of them. But when we talk about post-acute, it means that you have started to have symptoms that are typically different than what you experienced when you had the more active part of your COVID infection. So we think about flu-like symptoms and cough and, for people who have really severe COVID-19 infection, you could develop heart damage and lung damage and blood coagulation disorders in that acute phase. And that is something that needs to recover. That's part of your acute illness. But what we're seeing for long COVID is that after you sort of start feeling better from that acute phase, these other symptoms start. And they can be, like I said, really confusing, but they're typically can include fatigue, dizziness, this idea that's called brain fog, which is really more akin to traumatic brain injury, and difficulty breathing, difficulty sleeping, GI problems with your digestion. There are, according to the National Academies of Science, Engineering, and Medicine, 200 symptoms that have developed, known to have developed after an acute COVID-19 infection. And so many people in this space say, if you've met one person with long COVID, you've met one person with long COVID, because it can present in so many different ways. But as with anything, if you are having persistent symptoms that are disrupting your day-to-day normal activities, the hardest thing, but the most important thing, is to step back and carve out time to rest and see your doctor. That is not always easy for everyone. Middle-aged women, who has time? But that's what you've got to do, the first step. It is very natural to not really understand everything that's going on in your body, but I would ask that you gently pay attention. What am I experiencing that I can then communicate to my healthcare provider and my healthcare team, and start there?
Very solid advice. You have mentioned to us that as you got long COVID, obviously it changed your entire life, physically, emotionally, and professionally and socially, obviously, as well. What did you feel like were the biggest ways that you found since then to adapt in healthy ways? And do you have any advice that you might give to somebody who is just at the beginning of their chronic illness journey on how to adapt in a healthy way?
Yeah, it's such a good question and a really personal one to answer, because everybody's going to want to, need to decide what's right for you. And I'd be interested to hear what you guys have to say, but I think you have to assume you're going to be here for a little bit, and you need to change a little bit of your life to accommodate it. Pushing through by force and will is not likely to help. And I think that's the first mind shift that needs to take place, so that you can set aside time, not only to see the million doctor appointments that you're probably going to get signed up for, but to also process emotionally what you're facing. It is very important to keep optimistic and hopeful. And that is very different than saying that you have to have like toxic positivity and just think good thoughts all the time. You guys are probably have experienced this, but I've met so many people with chronic illness now that I feel like every person with long COVID has become a philosopher. Like, you really start assessing what is important in my life, what do I get meaning and value out of? And so it goes hand in hand with having to stop, being forced to stop, feeling like you're in solitary confinement sometimes when you're in bed, and really facing the grief and deciding how you're going to stay motivated to keep going.
The grief. The grief comes in waves. I think it comes in waves. I mean, I'm years and years over, I'm 15 years, I think, into my first autoimmune diagnosis. And I just like, very different story from yours, but I definitely feel the pain of having your life derailed by health issues. I feel like I had just started to really figure out how to learn, like how to live with all of my autoimmune conditions. And I had a pretty good quality of life. And in general, I was doing pretty well, managing everything well. And then perimenopause comes along and nobody tells you about it. Nobody warns you for it. Nobody prepares you. You have no idea what to expect. And I'm telling you, I can't even think straight most days. Trying to work is beyond a struggle. Everything is suffering in my life because of this. And it's so hard to find someone who knows how to help me. I think I'm doing all the things right, but I feel like I'm at a standstill right now. And I know I'm not. I know I'm not. And I know it's important to have that compassion with ourselves when we are going through these things. And like you said, that keep that optimism and have that good outlook. So I'm going to switch up my question just a little bit because I want to. I hope that's okay. But what would you say to somebody who is in the thick of it and really struggling to see the light at the end of the tunnel?
Well, we're all going to hit that point where, let's be honest here, you don't really want to do anything drastic, but you kind of don't want to be here anymore. You just don't want to do this anymore. And that's a really lonely place to be. And what has helped me is to remember that I'm not alone, that there are millions of people going through this, who have gone through this. And I'm telling you, everyone turns into like a philosopher or a Buddha or something. They're trying to tap into that community of energy, I guess, because you can't always see them. You're not always able to pick up the phone and talk to someone, much less like sit across the sofa and have a heart to heart. It's so isolating. What I see that has been helpful to me to be like, I know my ancestors struggled. I know my parents struggled. I know other people have this condition. I'm not someone who's like, oh, I have it so much better than X, Y, and Z. Instead, I'm like, I am also experiencing pain along with a lot of the rest of humanity. So that helps me feel a little less lonely. And what I'm seeing with my, I guess you want to call them followers and subscribers and the sort of long COVID community online, is this desire for connection that we have, sometimes for good and sometimes not very healthy, on social media. But I refer a lot to my long COVID friends. Like, I've met people through this who understand and get me. Like, I jumped on this call with you guys and I felt less stressed than I might have with another podcast, because I'm like, they get it. I don't have to explain myself. I can tell them I have a migraine because it's raining and they know what that means. So we're simple creatures. I think we are herd creatures. We need each other. But I don't know, what has helped you? What is helping you?
Community is huge. We always had the three of us as our own little community. We started the podcast because we realized how much that helped us to have each other. And because we were with some of the online communities, like you said, it is very isolating. There are so many people out there that are really struggling, who don't have someone close to them who understands what they're going through. And I think community is huge.
It's just very validating to talk to someone, like you said, who you don't have to explain it all to. Because most people don't want to hear it anyway. They don't care. They love you maybe, but they probably don't care. And they probably don't want to hear you explain.
Or they're not going to
everything.
understand it. Because ultimately, at the end of the day, if you've never experienced the kind of pain and exhaustion and terminal, ridiculously stupid crap that we have to deal with on the daily, you cannot comprehend it. I mean, I remember looking back on meeting someone with lupus when I was like 22 years old and thinking, wow, it must be so horrible to be this person. How hard it must be to even just live. And now I am here with lupus. And I think life is still beautiful. There's still so much in this world that makes it worth living. So you asked the question, so I'm going to answer it. What do? I allow myself, I gift myself slow mornings. I wake up and I let my body come to a place of equilibrium. I'm always going to have pain. That's not something that goes away. But if I am slow, if I am gentle with myself and gentle with the world around me, then I am a happier person. And you can ask my sisters, I am fire. I am very much someone who is, I'm Sagittarius, I'm a fire sign. And so I am very strong-minded, strong-willed. So it is an act of rebellion for me to be gentle.
Yeah,
And
that's what I was gonna say. Going slow is challenging, I think, for all of us, and it sounds like it was for you too. Perfect example. This morning, we have company coming this evening, and I had like the cleaning bug. And if you've ever had it, like, 15, 20 years ago, I could literally clean my whole house when I had that feeling going on. I'd turn on some music or whatever and just go to town and enjoy myself while I was doing it. I literally took one load of laundry out of the dryer and was like, oh my word, I am absolutely tapped. And I knew there were a couple things I had to do, like dishes or whatever, but I was like, I am going to allow myself, I just have to recognize the fact that I don't care what these people think of my house. I'm going to do the best that I can. If my kids can help while they're here, great. Nobody's here right now, but when they get home, if they can help before people come, wonderful. But if not, people are just going to understand that that's the reality. You have to be gentle with yourself.
we're so happy that you came and had this conversation with us today. We would love to have you let us know how our audience can find more from you, about you. Tell us a little bit about your podcast and other things you're up to.
Sure. So my podcast and my new Substack newsletter is called Long COVID MD. My medical business was called Zeest Khan MD because nobody told me that that's a terrible idea for your own business. But after a few years of being ill, I was like, I guess I'm Long COVID MD now. I started a podcast in 2023 to initially get over the shame of being sick. I tend to hide when things are not perfect. And I wanted to fight that instinct. And I wanted to connect and see who else was out there. So my daughter taught me how to open my computer and hit a recording software. And I've been podcasting ever since. I started the Substack about a year ago when my brain turned on a little bit and I was able to write and read a little bit more easily. On Long COVID MD, I try to translate medical information and scientific advancements as they're coming out about long COVID in ways that are easy to understand. It's very important to me when I take care of my patients in my practice that they know what is going on. So that's the mindset that I bring to Long COVID MD. My mission is to empower people. There's a lot of uncertainty in long COVID, so I try to explain how the healthcare system works, what culture they're going into, how this game is built, how this framework of healthcare is built, so they can utilize it to their benefit. Reduce disappointment, maximize results. So with that, I explain treatments. I talk about the life experience, as you can tell from talking with you guys, which is so important. And we have a community there of people who pick each other's brains. I hold webinars, live streams, and I interview some really, really cool people. So you can find all of it at longcovidmd.com.
Thank you so much. We're excited to share that with our audience.
Yeah, we'll include that in the show notes. I'm looking forward to looking to that myself. That's great information. Dr. Zeest, we appreciate you so much for being here with us today and for being vulnerable about your own story and so honest with us. And for reminding people and our audience that we're not alone in this journey, and that it's okay to ask questions and it's okay to seek answers. And in fact, that's the best way to help yourself when you're going through these kind of things. It's absolutely okay to advocate for yourself and necessary at times. And we appreciate you kind of giving some great advice in that area to our audience. And to our listeners, we're grateful that you joined us on Autoimmune Adventures today. Until next time, keep learning, advocating, and living boldly. And remember, you are worthy of joy. Disease does not define your life. You do.